It's probably one of the most powerful healing modalities that I've had the pleasure of working with. We'll say like, well, I don't know, I did, 15, 16 sessions and I didn't see anything change. And I think of it as soft tissue work on steroids. Everything I do has gotten me results that I don't think I would get with just working by hand.
I don't know any other modality in medicine today that has more paper than chalk, like from all the modalities that we use. And it's literally the only modality that it's finding use in orthopedic, in aesthetic wound healing, heart regeneration, neurology for Alzheimer, strokes, brain tissue treatment, urology, erectile dysfunction, Peyronie's, one single modality that is doing all those things. So today I have Dr. Lacina with me. And how long ago, when did I do the first shockwave training with you?
I think it was like about 12 years ago.
Wow.
Yeah.
Wow. Okay. So this is my question. What did you knew 12 years ago about shockwave versus what do you know about shockwave today?
So what I knew 12 years ago about shockwave was almost nothing. I knew that they had done it at school. We had used it as one of the modalities in the clinic, and I knew that it was helpful, and that was about it. And where I was working at the time, the chiro that I was working with basically said, I want to add something to our clinic that's going to upgrade it. Well, what's your opinion on this? And I didn't even think about it. It was on shockwave without even thinking shockwave. I knew, or I had a feeling that it was going to be useful. It was going to be an excellent modality for healing. It was going to shorten treatment times. And that was really about it.
Yeah.
It was a hunch more than a really solid knowingness of it, simply because at that time it was a newer technology and not a lot of people were using it.
Yeah.
Right? We were just fortunate at my school that stores had basically given us a machine.
That's actually amazing. That's so good. That's surprising because, and I don't think so many schools still integrate. So you went to the
Canadian Memorial Chiropractic in Toronto.
Yeah.
Mhm.
That's awesome. That's awesome. So you have been using now shockwaves for 12 years. You've been part of Unpain Clinic for about what?
I think 4 now.
4 now, eh?
4 years, yeah.
Okay. So if there is a practitioner out there that has no clue about shockwave, or there is a practitioner that heard about shockwave, that knows about shockwave, how do we tell them what shockwave is and how do you use shockwave today yourself?
Fair. I would say that this is opinion based, but it's probably one of the most powerful healing modalities that I've had the pleasure of working with. I think of it as soft tissue work on steroids, really. So there's a lot as chiropractors that we can do with our hands. Most of us are quite good at manual therapy, and there's techniques that I use a lot and still use, things like ART or rapid neurofascial reset. And those techniques are amazing. And sometimes they don't always do the job completely, or sometimes we just need a little extra help. And this is where shockwave comes in, and it makes the job a lot easier. It's very much a modality that makes it easy on my body to practice. And I think it gives me access to a level of healing and regeneration for patients that would take a lot more visits otherwise. And I think too, as chiropractors, our wheelhouse tends to be a lot of spine. I think that's where we're most comfortable. Of course, we treat extremities, but I think my approach to treating things in the extremities, so rotator cuff problems, frozen shoulder, knee arthritis, hip bursitis, has really changed. It's improved a lot since using shockwave. And then obviously for scar tissue, best thing on the market, I think, personally. Yeah, it's amplified everything I do. It's gotten me results that I don't think I would get with just working by hand.
Yeah. Okay. We're gonna, so what does a client that, let's say you used to treat for shoulder before using shockwave versus now? What is their process? What is their experience? What is your experience? What is your confidence having this tool in your hand?
So in the past, if I had someone with, say, like a rotator cuff tendinopathy, that typically I would have treated with anything from a mix of manual soft tissue therapy to I do clinical dry needling. So I would have used those in conjunction with like a lot of rehab and stretching guidance, and then of course mobilizing of any relevant segments. Now, or sorry, in the past when I was working by hand, I would say that probably I would guess I would have to see someone between 5 and 10 sessions to start getting like quite a lot of improvement out of them and to get that ball rolling and
Yeah.
see some type of change. And it could have been quite a long treatment plan, right? Like this is something that could be taking weeks to like a couple months of solid work. And now with Shockwave, with rotator cuff stuff, 2 Shockwave sessions done right, and we're seeing people massive changes in range,
Yeah.
massive improvements in pain levels. Realistically, I don't know that I've seen anybody more than 5 or 6 sessions without massive improvement in how they're feeling, range of motion, that type of thing. So I guess as far as confidence goes, prior to Shockwave, maybe like 70 to 75% confident that I could deal with this and people would see improvement. And now, I don't want to be cocky. I want to give myself room, but
Yeah.
90% for most things, if they're fairly uncomplicated.
Yeah.
Yeah,
Yeah.
so it's definitely improved my ability. I know there's statistics and stuff, but that's
Yes,
my
yes, yeah.
reflection from
Exactly.
seeing people clinically.
It is your personal experience.
Yeah.
It's what you treat and all of that. So we're gonna go into this because we need to clarify this and we need to help practitioners but also clients, patients understand, because we know this from client experience. Like we literally have clients, that come to the clinic, fly from other places just to
Mm,
come in for treatments. And we're talking here about Shockwave. There's somebody that is listening around the world, whether it's a clinician or patient, they go and search. Shockwave is not regulated in North America. Training
mhm,
is not enforced, for clinicians, practitioners. Now everybody is hearing or has heard about the potential of Shockwave, but then they go buy the machine. They don't invest on the proper machine. They don't invest on the training. So when you're talking about Shockwave, or how would you explain the difference between radial pressure wave, which is they most of places call it Shockwave, versus focal Shockwave or the true Shockwave, and then going even further, how you actually do Shockwave treatment, let's say for the shoulder, versus a colleague of ours, like whether it's like a physio, chiro, massage therapist
mm,
that has a Shockwave device and does the Shockwave treatment. Just want to give kind of this bird view of Shockwave reality, because it is our moral obligation as a
mhm.
practitioner to share this with other practitioners and patients, just to guide them in the proper place wherever they are.
Right. So, sort of from a high level view, the way that I conceptualize radial, and there was a number of years when I only worked with radial versus focal, is just my experience with focal is that it seems to be more powerful. It seems to penetrate deeper for sure. And because it's a little bit more comfortable on the actual skin surface, it seems to be a lot better tolerated. Like radial is that bullet that's pushed by air compression, and it does create like sometimes a stingy feeling on the
Yeah.
skin, which a lot of patients, when you start turning it up to higher levels that you need to actually get deeper into, say, a joint, it's not really getting there because your patient's like, ow, that hurts. I hate this. And it's funny because often you'd have patients coming and going, oh, shockwave is the most horrible thing I've ever experienced. It's so painful. And then you find out like, okay, you've had radial, and the practitioner doing their very best was trying to, max out those settings. And the patient was sitting there gritting their teeth the whole time. And with focal, it's not like that. You really don't feel it a lot on the skin. It sort of just shows up deeper. And that's nice because then you can actually get those higher settings, deeper penetration. It seems like better healing. And it's interesting too, because as you're going along, like with the focal, oftentimes people will be like, ooh, that spot right there. And it's almost like a diagnostic tool while you're treating. So you're like, oh, okay, that's the sore spot. Okay, let's get in there a little bit more and let's actually target that. So, I mean, do I still use radial? Yes, absolutely. But now it has taken a lot of the place of like, I would almost say like a very expensive massage gun.
Yes, I know.
So, like I like it for places where we don't need the deeper penetration, or like if you want to get over muscle body, I find. So like if you have a really tight quad, really tight pec, that's awesome for that.
Yes.
It works phenomenal. So no shade against radial, but then like around joints and stuff, it hurts to have a radial hit your bones. And
I
so
know.
focal really just makes it way more comfortable and easier on the patients. And it does seem to get phenomenal results. So that's how that's changed a little bit as well. is just the difference in the kind of treatments you're getting and the level of discomfort for patients. So, I mean, like any therapy, there can always be some discomfort after you treat a patient.
Yes.
Doesn't matter what it is across the board, but we're not now having patients, needing to like grit their teeth or bring in something to bite down
Yeah,
on
yeah,
while they're
yeah.
getting treatment, right? Like, the most I think people ever tell us about during treatment now that I've ever heard about is, oh, it's a little bit sore, a little mildly achy, right? And that's awesome because now you're able to get those high settings and get the work done and people
Yeah.
aren't screaming at you.
Yeah, 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 yeah. So have you had any client in your experience, and this is not bad mouthing anybody, like every healthcare practitioner out there is there with their heart to help their client
Mhm.
with best of their abilities and what they have. So it's amazing. And thank you, every practitioner, for changing human lives. So have you ever had a client that, had shockwave elsewhere and then came to you, and what did they say the difference was, before another, shockwave treatment versus what you did?
So I'm gonna agree with you and say, yeah, everybody's always trying their best. And I think we don't know what we don't know. So we're limited by the knowledge and the training that we have. Sometimes the best knowledge and training that people have is whatever training came with their machine or whatever they had. So there is absolutely no shade to people who are operating to the very best of their ability. And I definitely have had people who have come from other places or they've tried Shockwave before. And I think the big feedback that we got was, yeah, like it was horribly painful and it helped. But sometimes too, we will get people who will say, like, well, I don't know, I did 15, 16 sessions and I didn't see anything.
Yeah.
And then we do it and we do 3 or 4 and they're like, okay, I do see the change. And I think sometimes that is definitely the machines. There is a difference in quality of machines, right? I feel like you can't really cheap out on these machines. There is a difference between radial and focal. And I think there's a difference too, and again, like how you're applying these things. So I think just even working with you, I've learned a lot about like not just considering like the sore spot, but like looking at what is the antagonistic muscle group doing, right? Looking at, again, what else is around that articulation that needs help.
Yeah.
Looking at balances between muscles and is one overfiring or not firing well. And then really looking at like long chain kinetic stuff. So, we always think just because the pain is here,
Yeah.
that's where we should treat, but that's not always true. The bully causing the problems could be somewhere else down the chain.
Yeah.
And looking at those things, I think, and seeing people holistically and then using such a great tool to
Yes.
really has helped us leverage treating from, I think maybe I can help to, no, I'm fairly certain that we can help.
It's interesting, and this is bang on because it's always the cause. It's not really the symptom. So even
Hmm.
though shockwave, it's such a powerful tool, it's extremely powerful in terms of regeneration, breaking out scar tissues, adhesions, clearing up calcification. I've
Hmm.
noticed that if I don't hit the cause, we're not going to see that massive change, in 3 to 5 sessions. When shockwave started in Europe, it was done initially or used by orthopedic surgeons.
Hmm.
And I always say it's like that there are many ways. In the end of the day, it's a tool. So you
Hmm.
can use a shockwave as a welding machine,
Hmm.
you know, to if there's a bone fracture, non-union fracture, bruising, anything like that, you
Hmm.
hit the spot. That's where you see it on X-ray. That's where the damage is, and then you stimulate regeneration or trigger regeneration and repair in that spot. Because we are in private practice, and I always say we get paid based on results. If we create results, we get referrals, we get more people, we help more people. If we don't, you almost like go out of business because it costs a lot, to run a clinic and overhead and everything. So the way how, for example, we do it, or how I came up when I started using Shockwave, 2011 for first time, is yes, when I got the protocols from the manufacturer, they were like 2000 pulses, beat the painful spot. But then we have to remember that this tool is influencing everything all at once. It's influencing nervous system because it's triggering, it's hitting the nerve endings, it's going through the skin. There's mechanotransduction that goes through the tissues. there's a release, there's a biological response to the area, there's modulation of the inflammation, angiogenesis, stem cell activation, migration, all that. So you're pretty much influencing the body and all structures all at once. And then that's what gives, the release, and people, feel a little bit sore, or the change happens. But not every tension, as we know, needs releasing, because sometimes body it's stabilizing something. So
Hmm.
therefore it's extremely important to treat what I always say: treat the dysfunction while you're stimulating regeneration, right?
Hmm.
What has changed? Like, so when you started as a chiropractor to where you are now, because you have the foundation chiropractic adjustments, you do lots of soft tissue work, you
Hmm.
do manipulation, you have so many abilities, and now you have those regenerative tools, like you use the MTT as well. We do, neuromodulations and all that. How has your practice and the way you practice changed? I know it's similar to the question, but now this is much broader. It's like, for me, for instance, like personally, just to give some content, is I can see more clients. I'm less tired. I can help more people because I have the knowledge, to diagnose, but then I have the tools to deliver.
Yeah, I would say it's the same in that way. I definitely think I have more confidence treating a bigger range of things. Again, like I said, chiro's our wheelhouse tends to be spine a lot. So now, though, give me any joint in the body, and I'm fairly confident that I can figure out what's going on and actually make a change. So it's given me the ability to access and treat a lot more of the patient with really high levels of confidence. It is absolutely easier on my body. Oh my goodness. I think patients are a lot happier because like when we're all wonderful people, but patients don't come to visit us necessarily, right? They come for results. So they're happy when they get results in shorter time periods and with like not a lot of discomfort to get those results. And I would say too, it's given me, I look at people a lot more holistically. Not that I didn't before, but I
Yeah.
think we get trained a lot to just consider like joint above, joint below, right? And now it's not necessarily how I'm considering people. I'm not just considering joint above and joint below. I'm considering like what happens at your feet and how does it go all the way up to the top of your head. So like even as an example, without giving too much away, I did see a patient who had like leg pain in their lower part of their leg. And it turned out that that leg pain was all coming from like stuff up around neck and jaw.
Yeah.
And it really wasn't even anything to do with the leg. It was just the leg was where things were kind of creating problems. And so then looking at that, it's amazing to be able to go in and be like, okay, so now I'm going to treat this and this gets better. And there's like, I have lots of examples like that. Yeah. Where you find the weird thing. And then the cool thing is too, is like ankles with Shockwave. That's something that blew my mind, but has made such a difference because that's foundational to the body, right? Foot and ankle biomechanics. And if that's already lacking, it's like your body's playing a game of telephone and the message was bad from the first person. And it just gets worse as you go up the body because it's so heavily proprioceptive. And like for the longest time, my answer to that was, okay, well, we'll give you rehab exercises, balance things to do around the ankle. And, that should help. But then you can come in with Shockwave, with focal Shockwave. And you're like, it's like immediate. You can see people as soon as you're done a session. They're like balancing on an ankle that was wobbly and now it's not wobbling at all. And then even more interesting than that is they'll come back for a future follow-up and you're looking at them. And sometimes like the wobble has come back a little, but sometimes it's still not there at all. Yeah. And so now imagine if your body is creating or deciding how every single muscle and joint needs to fire from the foot up. And now you've given it a better foundation. Everything along the way is just going to do so much better. So that's so cool that we can do that before. And I don't actually know of anything really that does that same sort of thing with that same intensity, at least in that short of a period. Like it's crazy.
I know. So do you have, I don't know if there's any even word to describe this feeling. Like every time when I treat a case, it's just like I have that confidence that's it. It's like, okay, like this is easy case, because it's like I've seen it in the past. I've seen the pattern. I never look at anyone the same because, like the etiology of the dysfunction, it's never the same, but you recognize patterns. What happens if you do the treatment,
Mhm.
it doesn't work, and then do you have any case that you were able to kind of figure out what the cause was and how you treated that?
Like where we were not really sure what was going on and then
Yeah.
we did a pivot.
Yes.
Yeah, I can think of one semi recently, again, without giving too much
Yeah.
away. They had um, a back issue and also from a prior surgery, some scar tissue around sort of their sacrum or tailbone for,
Yes.
tailbone for
Yes.
people who are listening. And we had approached it initially with, we're like, okay, we're going to mobilize, we're going to adjust, reasonable, right? We'll do some myofascial release work just by hand,
Yeah.
figure it out. Um, and some of it got better and some of it got worse. And both of us were very mystified, going, what is happening? Because this should be responding this way. And that was when we kind of realized that maybe that scar tissue that we decided to release by the tailbone was actually stabilizing or holding something.
Yeah.
And when we released it, it decided that it was not very happy about that. And you were right. You said previously, releasing things sometimes, yeah, if you're not also activating the proper thing that should be
Yes.
providing the stability in that area, sometimes it can be bad news. Like, especially you think about scar tissue. The idea of scar tissue is it's like it's fixing, right? It's your
Yeah.
body's duct tape. And scar tissue, I've heard, really likes to grow towards anchors, right?
Yes.
Like it's trying to stabilize. And so then, yeah, sometimes if you're not careful and you turn off your scar tissue without considering how do we turn on the proper stabilizing thing, it doesn't always go how you plan. But so then we pivoted and we went to doing shockwave, actually. So we ended up doing shockwave for the lumbar spine and that sacral area that was the problem. I haven't seen the person, but I touched base with them via email, and
Yeah.
the report was I am 95% better after one treatment. So I was like, oh,
That's
good.
amazing. That's
Yeah, no,
amazing.
it's always good to kind of
Yeah.
know you're like,
Yeah.
oopsies, and then no, we're good.
Yeah. Wow. Wow. So I'm gonna go a little bit more on the because obviously I teach shockwave
Mhm.
for years now. And it still surprises me stories that I hear. I'm gonna share three stories. One is I had a runner who had to fly from another city, like from Victoria, just to come for treatments because he went locally to a physio clinic, had 10 sessions, nothing changed on the
Mhm.
Achilles tendon. And then he told me they didn't use gel. So there was
Oof.
no conduction. Okay, that's why the shockwave didn't work. So now who do we blame? In this case, device practitioner patient. Second case, I just had a client who came back, from Hawaii into a local place. And this is a client of mine that has been getting shockwaves for probably 15 years. So she knows a lot about it. And then this guy had a really good device, hydraulic system, but he was using CBD oil instead of gel. So
Mhm.
now it's the other extreme. Yes. So oils are good conductors. Like it's better with oil than without gel or nothing,
Mhm.
but the proper medium is ultrasound gel. And then we have to think that every time when you numb the skin, you are almost reducing and disengaging nervous system involvement, and therefore shockwave effects would be less. That's the reason they did start this in Europe, because initially when they started doing shockwave, they were using lithotroper devices to
Mhm.
treat bones, and this was very high energy shockwave. And then when they moved to plantar fascia and tennis and golfer's elbow, they noticed that if they use anesthesia, the shockwave effects were less than
Really?
without it. Yes. So shockwave is this tool that it's pretty much like involving the whole nervous system in its initiating or restarting the healing cascade. Then the third thing is I just heard recently there was another client that was from out of town, like 3 hours, and then they went to a local place. I think it was a physio place, and they said, no, we cannot do shockwave in your back. So these are things that patient clients are hearing all these stories, all this is happening. Is there anything that you did not know that can be treated with shockwave before and now you do it in regular basis?
Yep, definitely. So as I mentioned, the ankles before,
Yes.
yeah, all the time now. I think that's probably it almost doesn't matter what I'm treating. I'm always asking patients like, okay, have you had a history of ankle sprains? Like, what's going on here? How's your ankle foot
Yeah.
mobility? Right. I didn't weirdly, TMJ was something that I was kind of like, oh, we can do that. And like how good it is, right? Especially if you're using the right settings. Massive difference for people who have TMJ. And I wouldn't have thought initially that you could treat like very acute back pain stuff
Yeah.
with it. I always kind of thought, okay, this is something that is probably best applied to like sort of that subacute to chronic problem. But weirdly, people with fairly acute back pain do respond very, very well to shockwave. Sometimes I don't know that I've seen people respond that fast. So like, I think they say the natural healing time for like a disc injury is something like a year without any treatment. That's what I've heard. I have seen people go from I'm bent over and can't put on my pants with disc stuff to 3 or 4 sessions. They're like, well, it's a little achy locally in my back and maybe a little bit into my glute, but I can like walk around, do all the things. And you know what I mean? Like I'm dealing with it. And that would definitely not in the past have been my go-to, right? For that, like we would have probably done manipulation and mobilization to the degree that it was safe and then tried to, do some dry needling or acupuncture or whatever would have been reasonable to help with pain, give those postural exercises that we all love. And now it's so much easier.
So it's interesting. Yesterday I had a client and I'm treating for hip issue. He's going to a physio for shoulder issue, which we're going to treat the shoulder next. And then, I'm not biased. Truly, we do this to shine a light in this beautiful tool to help people to change lives. Obviously, it's not going to work for everybody. For most of the people that we treat, works very well when it's used properly. But then he was sharing the conversation that he had with his physio, and the physio said it's like there's no research on shockwave. Shockwave doesn't work. And I don't know what to say to these practitioners because there is like, if we look at the research on shockwave, I don't know personally. This is personally. I don't know any other modality in medicine today that has more paper than shock, like from all the modalities that we use. And it's literally the only modality that it's finding use in orthopedic field. It's finding use in aesthetic field, wound healing, heart regeneration, neurology, like now for Alzheimer, strokes, like brain tissue treatment, urology, for erectile dysfunction, Peyronie's and all that. And it's like one single modality that is doing all those things. So with this conversation, I truly want to help these practitioners that are stuck, in that they have no clue about the potential. If they take this tool, combine it with their current knowledge that they have in diagnostics and treatments, what it will do for, their patient, for their client, for their practice and for themselves, because you've done a lot of manual therapy. Now, when you find, a tender spot that you want to release it, do you really bother with other things or do you just go straight with shockwave? Because you kind of expect,
It
or how do you approach that? Like that's a better question for you.
I guess it sort of depends on, like, I mean, a lot about history, but I mean, all of us will say that we are like evidence-based practitioners, right? So when we say that, what we really mean is that whatever we do for patients is a combination of what the literature says, what we know from our training, what we know from our practice experience. And then also it's the patient has beliefs in certain things that they're open to and not open to, right? So you have to respect those preferences. And so then when I approach things like that, I think I weigh out the balance a little bit of, okay, what type of injury is this? How many times has somebody else treated it, right?
Yes.
What has been done in the past? Is this something that I've seen before and have been able to tackle with, say, just manual? Or is this something where I've seen it a lot of times and I just know that if we apply shockwave, this is going to be sort of the easiest way forward. And I do have patients who have a preference to start off working manually and we see what we can get done. Right. And sometimes we get full resolution without ever using shockwave. And sometimes we do 3 or 4 sessions and my patient goes, I really want to play with the big guns.
Yeah.
And I'm like, you know what? It's reasonable. It's safe. Right.
Yeah.
So I think that's part of it too, is also weighing that factor of, is this safe for this particular problem? Do I have experience treating this particular problem with shockwave? Is it reasonable and it's what the patient wants?
Yeah.
Right. I mean, it definitely is, I would say, as far as care goes, Shockwave can be a little bit of an investment for patients.
Yeah.
Right. I mean, and it is an investment in your health. So it is a good investment. It is a good investment to make as far as I'm concerned, but that can sometimes factor into it too. Right.
Yeah.
Is, am I
Yeah.
ready to make this particular investment? But I would say for a lot of things, if I was dealing with those particular problems personally, the first thing I would run for would be Shockwave.
Yeah. Yeah.
Like all the time. And I think you've definitely seen me sometimes if my wrist is sore, like shockwaving myself in one of the treatment rooms. I was dealing with the plantar fasciitis stuff. So
Yeah.
not me with my own foot up on the table, like shocking myself. But it does make a difference.
Yeah.
Right. And I have found it for myself to be personally amazing as well
Yeah.
for getting rid of things and getting rid of them quickly. Yeah, sometimes if I have the choice or the option, and I would say I always provide it as an option when I'm talking about the choices patients can make for their
Yeah.
health. It's very rare that I leave Shockwave out of the conversation.
There are two things that are coming to my mind. So one is too good to be true, but it's true. And then the other thing is literally I was thinking about this because since there's no, devices or like devices that we use,
Mhm.
at least, they are FDA approved, they're Healthcare Canada approved, they're true shockwave devices, they have the science and all that. The market is flooded with like copycats. There's lots of products that, come from China. Like I've heard people buying, devices in Alibaba and then thinking they're doing shockwave and patients thinking that they're getting
Mhm.
shockwave. But despite all of this, because it just in Europe it's been used, like the first society of shockwave in Germany was established in 95 digest.
Mhm.
And so then there's International Society for Shockwave Treatment. So in Europe, it's regulated. It's part of the hospital and hospitals system. Doctors use it more and all that. But then in North America, it's just like booming. It's just accelerating so fast. And then still, even without training, the good thing is that it doesn't really have side effects. It's not really hurting people. Otherwise, like insurance companies and legislation would actually enforce training and enforce, regulation if there was damages from the shockwave. It still
Mhm.
has the potential, especially with a focal if it's not used properly. Can like if you use high energy in the thoracic area, you can cause pneumothorax, like blow out
Mhm.
the lung. So you have to be careful. So yeah, it's truly incredible. And then personally, because I always like to find, what is the next revolution treatment? How can we help people more? And the rule is without side effects. If I want to be able to use it in myself first. If it's safe for myself, then I would feel comfortable, to use it on anyone else. And doing it for over 15 years now, I kind of got in a way bored from it because I'm looking for like, okay, how can I find something better than this? And I can't. I just kind of go back to the shockwave because it does so many things at once. Yeah. So is there anything that I should have asked you and I didn't?
That's a good question. Hmm, I don't think so. I guess the only thing that I will say is just again, I think that the quality of the treatment you're going to provide, especially with using Shockwave, is so much dependent on, you know, not just what is your training period. Doesn't matter what healthcare profession you're in, but like what is your machine specific training? So that definitely has made a difference. Like I worked with Shockwave before I worked with you at Unpain, and even the results I'm getting, and we have the same machine as you,
Yeah,
just the
yeah,
radial
yeah,
version.
yeah.
The results I'm getting are much better with more training, like doing all the training with you, doing the whole weekend long
Yeah,
thing
I
that we
know.
did.
Yeah, yeah,
That was awesome. And it's changed that trajectory. So I think people who want to use Shockwave, if they want to use it really effectively, they should be investing the money in a good machine. They should be investing the money in really good training, right? I'm not me sucking up to you, but
yeah,
it's true though. It really
yeah,
is true. The quality of the training that you've given us here is top notch. Like I have
yeah,
no notes. It was great training. And I think that fact of having the better training and the better machines has just really made what we can do with them that much better for patients. So, it's worth it, right? Like, and as practitioners too, I think it's incumbent upon us if we want to do right by our patients if we want to make sure that we are providing the best care, then it's incumbent upon us to source out the best training, to source out the best machines, and to make sure that we're doing anything we do in a level of really high integrity and ethics. Right? Patients first, patients always, most important thing, how are we treating them? And I feel like if I wasn't as knowledgeable in shockwave as I am, I would potentially be doing a disservice. And I think you're right. Shockwave is one of those things where, usually the biggest risk is your patient is going to feel sore after, because most of the time they won't stay on the table long enough for you to crank the settings high enough for them to hurt, to get hurt. But even though it's a relatively, I would say, safe modality, again, you are also still sort of that duty bound to provide good quality care that's actually helping them too, right? Not just to not hurt them. And getting better training is massive for that.
As you were saying that, I remember as a kid, there was a story, an analogy, how important is to know how important the training is. This guy took the car, to the mechanic to fix it because it wasn't working. And then he just took the hammer, did once, the car is fixed, it started, and said, it's $10 for this. And then the customer says, like, how come you just like took the hammer, hit it once, fixed it, it's like $10. That's such a quick job. And the mechanic said it's like $1 it goes to the hammer because I have the hammer, but $9 go to me knowing where to hit. So it means it's like, and it still blows my mind because honestly, I've trained hundreds of practitioners, and these are practitioners that with moral obligation to do it properly themselves, they took the training, they do it, properly. But then I have practitioners that I'm a practitioner myself, and I just don't know the logic, and I'm trying to figure out even publicly here. I had a guy who invested literally radial focal EMTT. So that's a investment of around $130,000. Okay, for those 3 devices. And then he comes to me and says, your training is expensive. And the training for all 3 of them with all protocols, it's 3,500. Okay. I don't know the math here, but it's what are we talking about? 3, 4%, 5% of the investment cost to make those devices work properly. So I don't know. I just truly hope, and I genuinely thank you for sharing this with others. Whoever is listening out there, whether it's a clinician or a patient, it's our duty, it's our moral obligation, because we have been doing this for so long. We just want to shine again light and just kind of share with the public, with the audience, the pros, the cons, what is good, what to look for, and to go from there, and everybody helps, so
For sure. And I think too, sometimes I feel like patients are maybe a little bit afraid to ask questions of people like us. There's this, you know what I mean? We get put up on this pedestal, or sometimes people think we're maybe unapproachable. And actually, I hope that's not the case, but I actually love when patients have a lot of questions for me. You should question me. You should question my knowledge. You should question how I know things, what my training is, whether I can help you. Because realistically, it should be upon me to prove that I can do all those things, to show you that I have the knowledge and to earn your trust, right? And patients shouldn't be afraid to question us and to throw us hard curveballs. I think that's the mark of a great practitioner, is that you are willing to meet all those questions and you're excited for that curious patient, right? And patients should be discerning about practitioners. So asking the type of training that they have, how long they've been working with a modality, totally reasonable. And those are all questions that even I ask myself when I am the patient, right? I don't always wear the provider hat. Sometimes I'm in the office and I have an issue. And I just hope that patients for sure see me and hopefully see Unpain as that place where they're allowed to, put the feelers out and know that we're here to answer your questions and to be supportive, and we're very happy to tell you what we know and how we know it. Right.
Exactly.
So
that's why it's as a client, as a human, you are the CEO of your own health.
Mhm.
Your health is your own responsibility. And then it's a journey. You have to go and look for it. And nowadays, with technology, with like, look at this public information, this knowledge, it's free, it's out there. Listen, make your own decision. At iloveshockwave.com, we have created, like, on the bottom of the website, there is a find certified practitioner. These are all practitioners that have been trained by us. Wherever you are, you can find it. And we just wanted to be helpful for you to find, a practitioner or clinic that is trained properly in the shockwave. And then we don't do trainings actually for devices that are not true shockwaves, or they're not coming from Europe, or like good devices. It's like, even the training is like specifically only for devices that truly are, register, produce good shockwaves, and all of that. Yeah.
Good. Yeah.
Okay, Lucina, thank you for your time.
Thank
Thank
you.
you truly for helping people, because you never know. Like, even this session today, it's a free information. It's a guide for somebody in pain, or for a practitioner who's looking to start in shockwave, and just to kind of remove that fear,
Mhm.
and give the example that, yes, when you do it properly, when you have the proper tool, it is worth the investment. Yes, it is expensive, but it's
Mhm.
more expensive not to have it, and it's more expensive not to use it properly, and it's even more expensive not to help people. If there is a tool out there like Shockwave that can make this big difference, and not having in your practice, it's a disservice.
Yeah, I would agree with you definitely to a
Yeah,
degree. And I
yeah,
think where it could be probably really, really helpful is for people who work in communities where maybe it's them and maybe one physio, there's
yes,
not a lot
yeah,
of access to those types of things. And yeah, as a practitioner, if you want the longevity of your career to increase, it's probably easier to do a few sessions of shockwave than to muscle through a manual release
yeah.
session 5 or 15 times. I know my hands and shoulders hurt less using shockwave more, that's for sure.
Yeah.
So yeah,
Okay. Thank you, Lucina. And thank you, everybody who has stayed with us until this moment. Okay.
thanks.
Thank you. And an angel king.